I am Dr. Vasan. I'm a urologist and an andrologist. In this series, we are going to discuss patient pain points. I get a lot of patients who are normal, and andrology is a science wherein there is dysfunction. That means an organ does not function effectively. It's not a disease, but it's a dysfunction. Consequently, a lot of people have a difficulty in understanding why it happened to them. So, in this series, I'll take you through several instances and several of your questions which you might have, which we will try to answer. The first point is that I'm married and me and my wife are happy together, but we are unable to conceive. Why does it happen? Because many people believe that fertility is natural process, and if I am able to have sexual activity, it should happen. But we have to understand that the body produces what is called as semen, which has sperms, which need to be in specific numbers and in specific formation for you to have a baby. Sometimes it may be deficient or it may be absent, and consequently there may be challenges in having a baby. Now, we also know that the challenge could be in men or it could be in women. The first thing you do, if you feel that you have waited sufficiently long, normally we say you have to wait for a period of 10 to 12 months after getting married to start getting worried. But if you are in an age group of above 35 or nearing 35, naturally there is a need for you to have a baby much earlier because of the responsibility of bringing up the baby and making him or her go to a class when you are physically fit and financially able. So consequently, these people whom we call reproductively elderly, not classically elderly because you are only 35, to have a checkup much earlier. What is a checkup done? It is a simple semen test. Basically because it can be given by the male very easily and it can be sent to the laboratory. What are the requirements of the semen test? Ideally, you should not have had sexual activity or masturbatory activity for 48 hours, and you should collect the sample without using a condom or any sort of liquid material, be it a saliva, be it water, be it gel, so that there is no contamination, and try to collect the sample in a very clean way in a sterile hospital given container, or you could possibly buy it online, and deliver the sample to the hospital within 45 minutes to 1 hour. This knowledge series, which is being discussed, is brought to you by Andrology department of Aster Hospital. The purpose of this knowledge series is to empower you and to educate you on all your questions regarding the field of andrology, more specifically male fertility issues, conception issues, sexual issues, ejaculatory issues, and what we call as men's health. Now, what is men's health? Men's health is all about healthy, active aging. We all know that India, being the diabetic, hypertensive, and dyslipidemic capital of the world, has higher incidence of sudden cardiac death. And we all know that preventive health plays a major part in ensuring we are there for our family, because in many cases the male is the sole breadwinner for the family and his responsibility is immense, and he neglects his health during the crucial years of 40 to 60 because he's more focused on family and children's education. So we in Aster believe this is the support you require, be it to prevent malignancy risk, to prevent heart attack risk, to prevent any significant risk, bone risk, psychological risk, which we call as preventive assessment. And that's what is the men's health program all about. So in this knowledge series, we will educate you for any of your questions, any of your queries. You're most welcome to call Aster, and we are happy to help you and provide support.